Local researchers want your help to test a new treatment for fighting the flu.
But it's not just seasonal flu. Joining us now to tell us about this groundbreaking research is medical reporter Liz Bonus. Liz.
Hi Paula, hi Rob. Infectious disease specialists at Cincinnati Children's Hospital are looking for adults of all ages to participate in a new trial that could fight off a virus potentially more deadly than seasonal flu. They've been selected as one of a handful of sites around the country to try and keep families healthy in a whole new way.
Little buttons.
For the past several months, Brody and Lincoln's mom, Sara, admits she's been worried about protecting her family from this season's bad flu outbreak.
I was worried about the flu. I had a baby nephew that got the flu and my brother-in-law had it.
Researchers in this lab, however, are worried about another kind of flu, one that potentially could lead to a far worse season than the one we just had should it spread. It is called H7N9.
The reason we're worried about H7N9 is because it has been studied and thought to be one of the higher risk avian influenza strains for potentially spreading in humans and causing a pandemic.
That's right, avian flu is now spreading mainly in Asian countries.
It's a bird flu where people are getting the flu from poultry.
Dr. Paul Spearman is an infectious disease specialist who told me the National Institutes of Health has launched a high-priority trial on H7N9 because it's more deadly than seasonal flu. He says nearly 4 out of 10 people who get it from poultry will die from it. So his team, now one of several sites across the country, testing a new vaccine to potentially stockpile and protect against it. What makes this trial unique is they're looking at a couple specific things. One of them that he references, which is very, very important, is something he refers to as interference. It's the idea that because a family such as Sara's got the seasonal flu vaccine for protection this year, that vaccine might actually interfere with an H7N9 bird flu vaccine.
Giving a vaccine first that has some relatedness to what you're giving a little bit later could interfere with that response to the second vaccine.
So now Dr. Spearman's team actually needs people who did not get the seasonal flu shot to help test this new H7N9 vaccine. As part of the trial, you're actually given both of these vaccines to make sure one doesn't cancel out the other.
We're also looking for antibody responses that can basically neutralize the virus, the avian flu virus.
The hope is that just like Sara's family, who barely got sick at all this season,
The baby had an ear infection, just one, and just little colds, minor colds, nothing major.
the rest of us could stay well too, especially against H7N9, should it start to rapidly spread inside the United States. If you'd like to participate in this trial, we have a phone number for you. It is 513-636-7699. Researchers follow you for about a year. All your care is free, and you are paid for time and travel.
I hope people do it. It's so important.
You know, that's why they're doing it now. While we don't have it, is
Yeah.
the time to have this, because once it gets here, it will be too late.
All right. Thank you.